and welcome. You're watching our special broadcast on COVID-19 where we get you the very latest on Omicron, the fifth variant of concern. I'm Sneha Mordani. First up, a look at the pandemic situation in India. Let's talk about the new cases that have been reported in the last 24 hours, a marginal increase from yesterday. 71,000 odd cases in the last 24 hours. But remember, when we talk about these cases, we are talking about the only reported and recorded cases via the gold standard of testing, RT-PCR test, and not the antigen test or home-based testing, which is happening most frequently in India right now and is being seen in this wave of the pandemic. India's active caseload has reduced significantly to just close to 9 lakh cases. The weekly positivity rate is presently at about 7.5%. We're talking about long COVID today, given that it's been over 4 weeks since the first case of Omicron was reported, and there are patients who've just recovered from Omicron, from COVID in the Omicron wave, and they are reporting some symptoms that seems to be associated with the long COVID. To talk about that, I'm being joined by Dr. Swapneil Parikh, author of the coronavirus book. Thank you so much for your time. You've been looking at patients, Dr. Parikh, and those who've also recovered. Just take us through the details of what they're reporting in terms of the kind of problems they're facing even after testing negative.
So thank you so much for having me on. First, just a little bit of background about post-COVID syndrome or long COVID. There are a few theories about why this happens. One is just that in individuals who've had an acute infection, especially to a pathogen against which they were naive, there is an inflammatory cascade that is activated, which can lead to these persistent symptoms. The second is that individuals may develop some kind of autoimmunity. The third, triggered by infection. The third is that individuals may actually have a persistent infection, that they may be ongoing replication of the virus somewhere in their body, maybe in the gut. And finally, individuals can develop complications, example, fibrosis in the lungs, that can lead to some of these difficulties. Most commonly, we see long COVID. So we look at it in patients who have passed 4 weeks from symptom onset and symptoms that persist for more than 2 months. So that is 3 months from symptom onset. And fatigue, cognitive difficulties, breathlessness, persistent cough, chest tightness, chest pain sometimes. These are some of the more common manifestations. And they can be quite troubling. Very often, there may not be any abnormalities detected on examination and on laboratory investigations. And it can be a very frustrating experience for patients because for many of these complaints, we don't really have too many treatments to offer other than time.
But would you say that these will get resolved over a period of time? And also I want to ask you about a very common complaint that is coming in from a lot of people of, prolonged cough and also muscle pain that continues after recovery as well. Dr. Parikh.
So even in other viral infections, post-viral cough is common. So a subset of individuals for some amount of time after they recover from a viral infection, a respiratory viral infection, can have cough. That is treatable. Those symptoms are manageable. It can be a little irksome, and as long as we're not suspecting a secondary infection, this can be managed fairly simply. In terms of the other complaints you mentioned, the muscle ache, weakness, fatigue, these are actually more disturbing for a lot of patients because there are very few things you can do other than asking them to rest and just try and wait. To your question that you said that do patients tend to improve? Yes. So the good news is that for most patients, they do tend to improve. The other good news is also that we expect that with vaccination, the incidence of the number of people who will experience this when they have a breakthrough infection will be lower than in the second wave when a lot of individuals were getting infected when they hadn't yet been vaccinated.
All right. Dr. Parikh, be with us. Today we are also going to talk about nasal sprays, and that's the reason why we are doing so, because Glenmark has launched a nitric oxide nasal spray called Fabi Spray in India for the treatment of adult patients with COVID-19. This in partnership with Sanotize. Glenmark has received, remember, manufacturing and marketing approval from regulators as well. The nitric oxide nasal spray as part of the accelerated approval process. Phase 3 trial in India met the key endpoints and demonstrated reduction of viral load is what the developers have also said. Dr. Monica Tandon is the Senior Vice President and Head Clinical Development Global Specialty Branded Portfolios Glenmark Pharmaceuticals. She is joining us. Thank you for your time. First of all, I want to ask you, when we speak about nasal sprays, there's just so much negative press and wrong press associated with nasal sprays, given that very early on, as early as last year actually, there were claims that were made by certain companies that these really work in preventing COVID. And they got pulled up for these claims, many of them wrong claims. What's your take on what's been going on as far as this entire market for nasal sprays is concerned?
Yeah, thank you very much for having me on this. So I think it's a very important question. I cannot speak about others, but regarding our product, the nitric oxide nasal spray, so we've just completed a trial in 306, a very robust double-blind placebo-controlled trial in our country, and we've released the results, and of course we'll be publishing them in a peer-reviewed journal as well. So the trial met its key primary endpoint, viral load reduction. Also the clinical, highly validated WHO progression scale, there was a 2-point improvement more in the non-SARM, which is a nitric oxide spray arm, in comparison to the placebo, which is a nasal saline. It's a topical product. It's not absorbed systemically, so it's highly safe. And I think that's very important. So this actually provides, it's a new tool because of its unique mode of administration. It's a new tool at this very crucial juncture of the pandemic when new strains are emerging which are highly transmissible.
Okay. I also want to ask you, by when will we see this in the markets, and also what's going to be the cost of this? Also to tell us, is the prescription required to go and buy this product?
So this is going to be available this week itself. And yes, a prescription will be required from a physician because it's approved for patients who have risk of progression, milder patients, but who have comorbidities or who are middle-aged or elderly who are completely non-vaccinated and therefore they have a higher risk. The entire cost of treatment of one patient stands about 850 rupees.
Okay, for one bottle of nasal spray, is that the cost, and what's going to be the quantity? Yes.
So that's 25 ml, and that's adequate for one patient for a complete treatment of 7 days.
Okay. All right, Dr. Monica, thank you so much. I'm just going to have Dr. Parikh with his last words really on the launch of the nasal spray, and your take really on, these kind of therapies that have come to the market in the past as well. This is not the first nasal spray that's available with our chemist here in India, but like I said, nothing definitive really. This medicine itself has got the approval from the DCGI for emergency use essentially.
Yeah, I'm going to have to really push back against some of those claims. None of those are peer-reviewed claims that we just heard. And I think patients should be very careful and should not be misled. Until we see evidence from clinical trials, I would view these claims with heavy skepticism. Let's keep in mind that reduction in viral load is not actually the clinical endpoint that matters to us. There have been many therapies that have had purported reduction in viral load without any impact on clinical severity. And there can be huge issues with trials where they actually try to show a reduction in viral load. In the era where we have a lot of people who've been vaccinated, I would question the role of such antivirals. I'm open to them when we see the data in a peer-reviewed journal.
Certainly. Dr. Monica did mention that they're waiting for the data to be peer-reviewed as well. We hope all works out, because at the end of the day, we need relief from this infection. Dr. Parikh, I've also suffered from it just last week, and anything that helps us really is going to be good for all of us. But like I said, until the data is peer-reviewed, let's take this with a pinch of salt. But good luck to you, Dr. Monica Tandon, and good luck to Glenmark as well. And thank you so much for joining us. Thank you, Dr. Parikh. All right, that's it from me for the moment. News continues around the Omicron, the 5th variant of concern. Do watch this space for more. Thank you for joining.